Scientifically speaking, we're sharing the view. From labs to clinics, breakthrough shining through, with minds that inspire and stories to unfold. Scientifically speaking, the future's being told.
Welcome to another episode of Scientifically Speaking with Christine on Oz Arab Media. Before we start, allow me to thank Laurent for the hairdo today. Well, today we're talking about something that affects millions of people. Weight loss. From me, ujur, as we say. But this time, this conversation isn't just about quick fixes or trends. It's about understanding the science behind weight, metabolism, hormones, mindsets, and long-term well-being. Our guest today is Dr. Mais Hussein, the founder of the Weight Loss and Beyond program, which takes a holistic, medically informed approach to sustainable health, focusing not just on losing weight, but also improving overall physical and mental well-being. Dr. Mais, welcome to the show.
Thank you so much, Christine. Good morning. How are you today?
Good. Yourself?
Not too bad. I'm very good.
Great. Although we have a very croaky weather today, but we'll try to sort it out with an interesting topic. If you allow me, I'd like to start straight away by how many people think that weight loss is simply about eating less and moving more. But from a medical perspective, can you tell us what's the bigger picture?
A lot of people. The simple answer to that. It's because for ages we've been misinformed, and a lot of people, they've been told that.
Yes.
From medical professionals, from their healthcare providers, from the magazines, the media, everywhere. It's just talked about eating less and moving more. And it's also been attached to willpower. So people think that they lack willpower, and that's why they're not losing weight. And then they go into that cycle of trying hard, decision, shame, failure, and then going again to the start. And that leads to what we all know as yo-yo dieting or yo-yo cycles. So the simple answer is that a lot of people have that misconception. The science have proven that it's not about eating less and moving more. It's much, much more than that.
Right.
And there's a lot of physiological, biological, environmental, genetic, behavioral, habitual factors that contribute to the disease of obesity, which we're going to be talking about in a second. And it's not just as simple as reducing, stop eating or closing your mouth. Or
that's a very good saying. They say in Arabic, like, I hate it.
Because it's the opposite. It's exactly the opposite. You have to sometimes eat more to lose weight. And we're going to also explain that in a second.
Definitely.
But there's a lot of mechanisms that are involved, and even weight loss on its own, it comes in stages. Like there are stages of weight loss. You can't just keep eating less, like till when you're going to eat less. Your body's going to adapt. Your physiology is going to fight back. Your body's going to resist.
Wow.
There's a lot, like we can talk for hours about the physiology of weight loss.
Definitely.
But it's definitely not as simple as just eating less and moving more.
Right. Doctor, definitely you've got a lot of information in your pocket about that. And you've opened or founded Weight Loss and Beyond program. Tell me, what inspired you for that?
What inspired me to do the Beyond program, I call it the Beyond program. So the actual big program is Weight Loss and Beyond.
Yes.
Because again, weight loss is not just about weight loss. It's way beyond the weight loss, or it's way beyond the number on the scale.
Yes.
What's inspired me is the people that come to me and they almost secretively ask for it because they lack the knowledge, they lack the support, they lack the motivation, they lack that correction of all these misconceptions that in a normal doctor setting, we don't have time to teach patients about that.
Yes,
and we don't have time to talk about all aspects of their journey, and they keep feeling lost. So the people come to me, they're desperate. I see a lot of tears in my office. I see a lot of desperation, a lot of loss. And that's when I was like, okay, we have the knowledge, we have the science, and we have the approach, we have the support. Why not put everything together in a very holistic approach where people can join and from the comfort of their homes. It's an online program where they can just listen to the lectures, do the tasks, have the knowledge. It's like a mini university degree that's very consolidated in just a 4-week period where people can just dedicate those 4 periods to learn and to understand their bodies and to understand why they've failed for the last 10 years, why they've tried every single diet out there and it didn't work, and what actually works and whether it actually does work. What are the solutions out there? We live in an era where we have a lot of revolutionary solutions that can help and aid in the process and in the journey. What actually matters? People are so focused and they're so consumed by the body image that's advertised in the media. So what actually matters? And when I talk to my patients, what actually matters to me more than them, because I try to fix the hidden
traumas, if we can say.
Exactly. And then just psychologically and also physically, I try to prevent disease from happening. The looks are just a byproduct, and there's just a side effect of the whole process, but it's a pleasant one.
Yeah, that's amazing. Doctor, obviously, there's a lot in the program, and it does seem different from the traditional diet-based models. If you can explain more to us, what is the approach? How is it really different than another diet program?
Basically, what I tell all my patients, that knowledge is power.
Yes.
If you have the knowledge of something, you can navigate life without any problem. So if you have a protocol or an agenda or a bylaws of something, or a structure of a certain project that you're trying to achieve, then you're going to navigate all the things, all the hiccups that happen along the way.
Yes.
So I put it as an example. If you're starting a project like a business, or if you're starting a university degree, you can't just go there and start it without having the curriculum, or without having a structure, without having assessments, or without having a deadline for something. So this program will provide my patients and my clients with exactly the same structure that they need to succeed any other project. And I call weight loss or obesity management as a project because it has to have a structure. So people usually might have some knowledge or might have heard something about the medication or something about an experience of a person that they know, but they lack the structure that fits into their real life.
Tailored just
for them.
Yes,
the program is not going to be personalized unless the patient comes and books for a one-on-one consultation. But the beautiful thing about the Beyond program is that it's a group education. So you will feel like you're supported by people who have the same struggles. It's a small group education, so you're not going to be overwhelmed by 100 other people going through the same struggle. It's going to be a small group education, understanding how weight loss happens, why does it happen and why does it not happen sometimes, understanding nutrition, exercise, how to navigate holidays, what happens if you drop the ball, how to go back on track. And because we're not talking about 3-month solution or 3-month fix, we're talking about a lifetime journey that you need to navigate. Because if I fix you for 3 months and then leave you alone, then there's no point, because my goal is not to see you succeeding in 3 months. My goal is to see you succeeding in 10 years.
Yes.
And in 20 years. And when you hit your 70s and 80s, to be independent, how to navigate health, how to prevent all the preventable diseases that are related to obesity, which can be more than 100 diseases. Definitely. So if you prevent that and you control what's controllable, then you can just be a little bit more relaxed about the uncontrollables, which we can fix by using medications. And we fix by using strategies to increase your natural hormones and fix your damaged metabolism that's been happening over the years of dieting and just, doing the wrong things.
Doctor, it sounds like it's like a one-stop shop for my health. And
it is a one-stop shop. It is a one-stop shop. So I can proudly say that I have both backgrounds, medical and nutrition backgrounds.
Yes.
So I decided to do a master's degree in nutrition and dietetics to exactly fill in that gap where doctors tell you to eat less and move more, but they don't know what to eat and how to move and what to do and what's the nutritional value in this food. How can you navigate, a sickness, or how can you navigate stress? All these things. When you have those both assets and also an experience in exercise, I don't have a degree in exercise, but I have a personal experience, but also I can consult exercise physiologists, physiotherapists if needed, gym memberships, PTs, all those things can be included in the program as well. And I can give the patient the guidance and not just it's like the bylaws, but not a playbook, if that makes sense. It's not going to be giving the patients step-by-step structure, because I know for a fact that something will happen along the track,
of course,
and they will fall off track. And then if they're not equipped with that knowledge, they're not going to be able to pick up and go back on track.
Amazing. Doctor, you did mention there's a lot of controllables and uncontrollables. Each person is different. There's things happening inside your body beyond just eating or exercising. Can you tell us what role do hormones and metabolism play in weight gain or maybe the resistance to weight loss?
Fantastic question. So just to keep it simple.
Yes.
If you want to lose weight, which is mostly the fat, let's
Yes.
say, the fat that's accumulated in the body, that's a form of energy. So fat is a form of energy that's stored in the body. And when you have excess energy, so excess intake, that's somehow along complex physiological processes that we're not going to go through today,
Yes.
will be eventually stored in the fat stores as fat.
Yes.
Now, back in the days when we had scarcity of food and this abundance and a more active life, that process was only done when there's a famine or when there's starvation.
Yes.
Which didn't happen much often because, or let's say it did happen, but the body was very efficient in storing and using the energy.
Yes.
Because the food-seeking behaviors were different. So back in the days, when I say back in the days, a caveman,
Yes.
they used to hunt for food, and if food is available and they're hungry, they eat.
They eat it.
And then food is not available, they just keep hunting for it. They're moving all the time. So movement and energy stores were
Sometimes
very
eating
efficient.
less, sometimes eating more, depends when
Exactly.
food is available.
Depends on the availability.
Yes.
So hunger hormones and satiety hormones weren't dysregulated.
Right.
Move forward thousands of years later, where we live in a life where we're not moving, we're sitting all the time, everything is comfortable, everything is convenient, and you go in a supermarket and you find an
Temptations.
just temptations, the abundance, like it's just
Yes.
thousands of brands that you're choosing from. People are not, they don't have time to educate themselves how to read labels and all that.
Yes.
On top of that, all the chemicals, the preservatives, shelf lives, all these things, that led to dysregulation of the hormones responsible for satiety and hunger, and also for hormones responsible for metabolism. We can name some of them: leptin, insulin, thyroid. All those hormones got disrupted, and then the energy is there, and you're intaking a lot of energy. You have enough stores for your body to store that energy because you're not using it,
Yeah.
and that will lead to accumulation of fat in those stores.
Wow.
Now, releasing that energy is not as simple as just eating this
Of course. Tell
and,
me
and,
about it.
and burning it by
Yeah.
exercise. Because again, when you have this dysregulation of the hormones, some hormones are actually fat storing hormones. And when your body is resisting the action or resisting the, they say, the function of those hormones, then your body's fat stores will just get stuck. And you get stuck in that cycle where your hunger is very high, your fat storing hormones are very high, you have a lot of fat stores to use in cases of emergency,
Yeah,
which
which
doesn't
is not
happen,
coming.
which doesn't happen
Yeah.
at all.
Yeah.
The cases of emergency, I think it happens in the pantry where we stock more food in the
I
pantry
know.
because, but it doesn't happen.
Yeah.
And then that's a cycle of producing more hormonal disruption because of a very important fact that fat on its own is not just a
Yes.
dormant tissue. Fat is a very active tissue that increases inflammation. It produces a lot of chemicals in the body. And that is a cycle where you get stuck. And it is now, because of all that, considered a chronic disease.
Wow.
So obesity or overweight is considered a chronic disease. And when we say chronic disease, that means that it needs chronic treatment. Chronic disease has multiple factors contributing to it. So it's not
Yes.
just your intake. But the basics of the basics, if you put in your body less energy than what you burn, then you will lose fat.
Because you're eating less, you're burning more or moving more.
That's the
Yeah.
basics of
Yeah.
fat loss. But you can control the intake and you can
Yes.
control the input somehow. When I say can control, like you can measure it.
Yes.
You can't control it sometimes by choice, but you
Yes.
can measure it.
Yeah.
But the problem is also with the output.
Yes.
Our bodies are different, and your output is different than my output, and that depends on your genetics and my genetics.
Yes.
It depends on how sedentary you are or how sedentary I am. It depends on what my mother ate when she was pregnant.
Oh,
It depends
wow.
on my genetics. It depends on my childhood eating habits. It depends on the first time I started dieting as a teenager.
Wow.
It depends on my psychology and stress. It depends on your sleep patterns.
Wow.
It depends on your stress patterns. It depends on your thoughts. So there's a lot of factors that contribute on your eating patterns, and that will determine your intake and your input and your output. So that eating less and moving more, which is input output, it's not just something that you can decide on all of a sudden and then decide that, okay, today I'm going to eat less and move more, and then you just think that the fat will be burnt off just like that.
And it won't, ask me, because I sometimes not eat at all and move too much and then not lose the weight and then get depressed.
Exactly. This is a cycle that I'm talking about.
Yes.
And in fact, this is a very interesting point because your body adapts. So
They
when
do.
you start to eat less, your body will adapt to that eating,
Yes.
to that less amount of calorie that you're producing, that you're introducing to your body, and your body will start becoming more efficient, and it will start burning less calories. So the
Yes.
output will reduce, which we call metabolism. So once you start dieting, that's the problem with dieting. Once we start dieting, two things happen. The first thing is your metabolism will drop.
Yes.
So you're burning less calories, which we don't want. We want to burn more
Yes.
calories. But the other most important thing is your ghrelin hormone, which is your hunger hormone, starts to skyrocket.
They do.
So how many times have you or anyone that's listening started to diet and then a week later they felt that they're starving?
Yeah.
Hunger hormones, they just go up.
It's like the devil in your head.
Exactly. You
Oh
start
my
thinking
God.
more about food. You
Yes.
start looking at food more often. You start
Yes.
just picking the food in the room. And then eventually what happens? You just fail the diet.
Relapse.
Relapse. But in fact, you did not fail the diet, but the diet failed you.
It's not
Because-
the right thing for you.
No, it's not what you decided to do. It's your physiology that's pushed you to
Okay.
quit the diet because it's resisting it. Your hunger is uncontrolled, which is also a symptom of obesity or being overweight.
Right.
So having said that, someone who doesn't have all these struggles, their hunger level would be different. They would eat when they're hungry and they will stop when they're full, and that's it. They're not going to be nibbling between or grazing between the meals.
Yes.
So it's a full picture. It's not just something
Wow.
that you think
The
about.
whole world.
It's a whole world. It's not a piece of paper that you give everyone.
No.
Follow this and you lose weight.
Wow. So, doctor, hormones and metabolism don't play a role. They are the role.
They are the role.
For weight loss or resistance to weight loss. And I'm sure you did mention that, but I like to let people hear it in their ears. So many people do lose weight initially and they get really happy about the results, but then struggle to maintain it. And I'm sure the Beyond program has an answer for that.
So the fourth module of the Beyond program talks only about maintenance,
Right.
which is the very, very important and very, very challenging
Yes.
point because yes, you are right. Losing weight is not the problem. When someone comes to me wants to lose weight, I get thrilled because I know that the process is easy. As long
Yes.
as there's an intention and there's a process and there's a structure, we can achieve a point where they're happy with their weight.
Amazing.
But then comes the struggle after.
Yeah.
Why do we struggle maintaining the weight? It's partly because of what I've just mentioned about
Yes.
metabolism, where you started at a certain level and then it drops. And then once you start or stop the diet that you've been under, which most likely is unsustainable
Yeah,
because
it's
you've
not
dropped
a
calories. It's
all
not
life.
something that you can do all your life.
Yes.
That's when you start eating a bit more, you become more relaxed, but the metabolism is here. It's not here. So you start creeping the weight again, and sometimes to a level where it's much higher than where you started before.
Okay.
So you start with a certain number, and then 6 months or a year later, you drop and you're happy, and then everything goes back to normal.
Or even more. That's why sometimes they say, I gained the weight and more. Like not only
Exactly.
where I was.
And that confirms that confirms the nature of the disease. It's a chronic
Right.
disease.
Right.
When we talk about diabetes or high blood pressure or asthma, all those chronic diseases that we treat every
Right.
single day, once you stop the medication, then more likely than not, the disease will come back or will not be under control anymore.
Right. This is maybe a question I'd like to creep into our scenario, if I
Yeah.
can say. You said that's where I'm gaining the weight and that's where the metabolism is staying. Is there a way I can bring that metabolism up? Is it a controllable or uncontrollable? Is it something that I have to abide by all my life? Is it fixable, doctor?
It is.
Yeah.
Good news.
Yeah, yay.
But it's not easy.
Right.
So, yes, the weight loss process, before I proceed with the answer,
Yes.
it depends where you're starting. Each individual is an individual case on its own. When you're starting with just a few kilos to lose and you just want advice on how to prevent more weight gain or how to lose some fat
Right.
to maybe look better, feel better, reduce inflammation, reduce stress, this is much easier process than someone who has a BMI of 40
Yes.
who wants
trying to lose 40 kilos.
100% or even more than 40
Yeah.
kilos. Now, the thing that we usually say is that this weight loss journey or your weight loss journey, whether it's 5 kilograms or 100 kilograms, it's a lifelong journey.
Right.
It is something that you need to address and keep in mind and make an effort to maintain for the rest of your life.
Right.
And some people feel that
I'm going to be restricted for the rest of my life.
That's right, but
Am I
they-
not going to drink alcohol for the rest of my life?
Well,
I can tell you a lot of stories.
100%, but that's
Yeah.
that's not the case because
Right.
flexibility and moderation is what we preach for.
Right.
But at the beginning, just to reach a point of equilibrium, just to fix the mess that's there, depending on how messy it is inside.
Right.
Because someone with a BMI of 40 will definitely have a much higher metabolic disturbance than someone with a BMI of 27.
True.
And the problem is that we sometimes don't catch those 40 BMIs early enough for us to prevent
Yes.
them from going to
Because the weight is creeping
it's
slowly.
creeping and they're not seeking help.
Yeah.
There's not enough support. There's not enough training. I'm talking about healthcare providers. They're not
Yes.
trained enough to detect the problem
Right.
early on and try to tackle it. However, these days we have those amazing tools. Like we have medications, we have, but it's a lot of gaps that we're trying to fix. Now,
Right.
going back, just I distracted the
Yeah,
audience
it's all
probably
right.
with,
That's
with
what
a lot
happens.
of answers. The thing that you can do is, first of all, you think about the journey as a lifelong journey. There's no quick fix. Some people come to me and they say, I want to lose weight for the next 3 months or within the next 3 months. And then the first question I ask them, why? Why the rush? Like the 3 months will pass. And if you haven't learned how to keep that weight off for the rest of your life,
They'll come back.
you'll come back a year later in a worse situation. So I didn't do anything. I didn't do any good for you if I do that for you.
Yeah.
But then I dig deeper and then I say, why the rush? They think that they have to do the extreme, and everyone has the none or all mentality. They either do it all right or they drop the ball and do it all wrong.
Okay.
We try to fix this mindset that we start with a habit at a time, one habit at a time, so that you master that habit before moving on to the next one. That's what gives you the long-term success. Now, in psychology, you will need at least 21 to 30 days to adopt a new habit.
Yes.
Not to master it, just
No,
to adopt.
adopt it.
Just to adopt, just to start saying, okay, I'm doing this now and it's becoming a bit more natural to me.
Yes.
It takes 90 days for that habit to become part of your life, and it
Natural.
takes almost 6 months for that habit for you to master it.
Right.
And when you talk about dieting and exercise and all these things, 3 months and 6 months are not a short period of time.
No.
If anyone has dieted for a week, they know that a week is a long time. Like, you know how they say 2 minutes on the treadmill feel like 2 years.
That's
When
true.
you're scrolling on social media, you can spend 2
You
hours
go on
without-
the scales after eating a healthy
and you expect it to
lunch
go
and-
down by 3 kilos already, and then you get frustrated if it doesn't.
100%.
So that's the first and the most important thing. You have to consider that if I make the decision to change my life,
Right.
it is a long term, it's a lifelong journey. That's one thing. Now, how do you maintain the weight? That's
Yes.
just to go back to your question. We have multiple hormones, natural hormones that will keep the weight off.
Yes.
And those are we're going to touch on those when we talk about medication.
Yes.
Those are the natural hormones that happen in your body to keep the homeostasis, to keep the balance, where you're actually eating when you're hungry and stopping when you're full, and your body is efficient in burning the fat. We want to increase the natural hormones in your body with nutrition, with exercise, with managing your sleep, with managing your stress. So the pillars of weight loss are food, exercise, stress, and sleep.
The very literally next couple of questions that I have for you.
Yeah.
Amazing.
It's exactly that.
Yeah,
And those are
wow.
weight loss is not complex. It's simple. It's doing the things that you do every day, but doing it right.
Forever.
Forever. Everyone sleeps. You just have to fix it a little bit.
Yeah.
Everyone is stressed. You have just to learn how to manage that stress.
Right.
Everyone eats every day. You just need to learn how to enjoy food but eat right. Do it the right way, without restrictions, without any drastic changes, without
Right.
elimination of any food that you enjoy.
Okay.
My goal is not to make you miserable.
Okay.
My goal is to make you normal. Enjoy food for what it is, because food is pleasure. But for that food to give you the right signals, the right satisfaction, the right nutrients, so we're fixing all that disturbance in your body. And then we go to exercise, and definitely more cardio isn't the answer. And running is not the answer. Going to the gym, if you don't like the gym, is not the answer.
I hate to.
A lot of people do. A lot of people do.
Right.
And I do understand. I'm not going to come and tell a person who hates the gym, you have to go to the gym 5 days a week.
It's a punishment.
I'm going to lose that patient.
Yeah.
They're gonna just hate me, and then they're gonna come back.
let go the ball easy.
Oh, maybe they're gonna join the gym for a month, and then when they drop the ball, they're not gonna even see me again because they're gonna feel ashamed. This is not the goal. And then one of the most important subgroups of that category is muscle. Muscle, muscle, muscle. Muscle is the most important longevity organ in the body. If we learn how to lose weight, but keep that engine, I call it the engine,
The muscle.
the muscle, if we keep it, and it doesn't take a lot to keep. It doesn't take a lot. People think that they have to hit the gym 5 days a week
Yeah.
or 6 days a week, and they need to lift the heaviest weight out there. Lifting is something that's great for you if you like it and if you want to do it, but you can also introduce it gradually. I'm not going to bombard my patient who has a BMI of 35, who has a lot of hormonal disturbances, with building muscle from the get-go.
Yeah.
We can just introduce it later on because they're going to want to do it.
Yes.
It is a
Amazing.
process.
Amazing.
And that's why if you're someone who's looking for a quick fix, if you're
Yes.
someone who's looking for a printed paper to tell you exactly what to do, then the Beyond program is not the right
The right
program for you.
Right, amazing. So all of this, if we can say, bits and bites of everything, looking after your hormones, the stress, the sleep, the willpower, the medications, the muscle, everything together is actually what's building my metabolism. Am I right?
That's correct.
As simple as I can
It
put
is
it
as simple
in.
as you can put it in.
Amazing. Now, many people themselves, are not for the losing weight. Like they do lose weight, but then they can't, or they put it back, and they think they failed. So I would like to know how much of the weight management is actually beyond the willpower.
All of it.
Oh. Can I say something before
Yes.
you continue? Something a little bit personal. I always tell my close ones when they say, come on, Christine, it's not that hard to stop munching, right? Just close your mouth and you'll be all right for a couple of hours. Trust me when I tell them, sometimes I go into a Bermuda Triangle. I don't know how I grabbed that bag of chips. I don't know how I gobbled it. And then I sit with guilt. I'm like, what the hell did I do? So for me, I believe this is beyond willpower, but is it me or is
Okay.
it something happening?
So I'm going to tell something that's very liberating for everyone who's going to
Right.
listen to me today.
Yeah.
You're not lazy. You don't lack willpower. You're not someone who's a failure. You are not responsible of your weight or the way you look now. You're probably responsible of the decisions that you're going to make after this podcast.
Yes.
That's the only responsibility that I'm going to probably
Amazing.
put on you.
Yeah.
Would you, if someone comes to you who hasn't taken their blood pressure tablets for the last week,
Yes.
and their blood pressure is high and now they're having a headache.
Right.
If I have a headache now because I didn't take my blood pressure tablets and because my blood pressure is uncontrolled, would you tell me, oh, come on, you can just stop that headache? Why don't you just control it or stop that
Suck
headache?
it up.
Suck it up. You don't have the willpower to control that headache? What would
No,
that
I can't. I
would
need
that
the
sound
medication.
would that sound crazy?
It does.
It does. It
Yeah.
does sound crazy. Or someone who has a tight chest because they haven't taken their puffer in the morning, something
Right.
like that, suffering from asthma or COPD, any chronic disease. Would you just tell them, oh, come on, just breathe?
You can't.
You can't. They're very tight in their breathing. You have to
Yeah.
give them the puffer. Sometimes serious enough to take them to the emergency. You wouldn't just stop and watch and say, oh, come on, just try to breathe. Oh, come on. It's the same. It's exactly the same. So, having said that, tightness of the chest is a symptom of asthma. A headache is a symptom of uncontrolled hypertension. Hunger and food noise and overeating, those are all symptoms of obesity.
Wow.
So we need to look at it differently. It is a symptom. You're not obese because you're overeating. You're overeating because you're obese.
Okay.
I think that sentence changes the whole mindset and the
100%.
whole perspective.
I hope my family is listening.
I hope so too. Oh my God.
Wow.
So it's liberating.
It is.
It's mind blowing, and
So that's where, sorry to cut you off,
No,
that's
that's-
where you actually start treating people with the medications, like for
yes.
weight loss.
When they qualify, so not everyone is
Yes.
a right candidate for the medication. However, with a pandemic, that's when I say pandemic, obesity is a pandemic.
It is.
It's almost approaching 40% of the population, including overweight and obese individuals.
And the numbers are going up,
And the
especially in
numbers-
Australia and adolescents. And
Yeah.
we've spoken about that in the episode.
Every nation has a high its own obesity
Yeah.
rate. Unfortunately, Western countries the obesity rates are much higher
Yes.
because in the Western countries and the civilized nations, it is a disease of the poor. If you want to put it in a way
Okay.
that if you can't afford healthy food, then you're more likely to become overweight or obese. That's in the
Okay.
industrialized countries. While in third world countries or countries that are a bit less fortunate, access to healthy food is much easier because they grow it, they have it. It's more natural. It's
Wow.
less preservatives. So it's the opposite. The rich, they do eat the junk food and they go to restaurants and
they've
they
got-
eat.
yeah.
So it's a disease of the rich in the other
Wow.
countries. But in the bigger nations where it's much richer, where there's more resources, unfortunately, the normal population is much likely to
Wow.
become obese or overweight. So
And that's what's getting them to thinking that they are eligible for medications. If I want to take you back to my point of uncontrollable or beyond willpower, that's where I need to take the medications. But
That's
not
right.
everyone is eligible.
not
So how
everyone
do you-
qualifies
Yeah.
because there are eligibility criteria. They're not very difficult and they're not very
Right.
tough on you. But access
Okay.
also is another issue.
Right.
Affordability is another issue.
Okay.
So a lot of people who qualify for the medication cannot afford it, and a lot of people who can afford it cannot access it.
Wow.
So we still have
what
a
an
lot of
ironic world.
we have a lot of future to look into,
Yes.
and a long way to reach a point where we can actually treat the disease of obesity or reverse it. So the future doesn't look promising, but at the same time it does because we live in the age of treating obesity. We
Right.
finally have treatments that are effective. Probably 30 years ago, we had some treatments.
Right.
There was some first generation medications that worked a bit, but it wasn't very effective. It produced a lot of side effects.
Yes.
It wasn't as safe as the ones that we have at the moment. There was surgeries as well.
Yeah.
Surgeries are a brilliant option for people who qualify for it, and I do encourage a lot of patients to seek that first line treatment in their case if it's the first line
Right.
treatment. But then that gap that was huge and became very big, it's now being filled by the second and the newer generation injections, let's say,
Yes.
which are acting to solve the core problem which we talked about, fixing the metabolism, cleaning the environment, cleaning the mess inside while you're doing all the right things on the outside, cleaning the head from that food noise, working on the reward systems where you are not seeking food for pleasure anymore. It's actually also been studied or being studied for types of addiction,
Wow.
not just food addiction.
Now you're taking me into two different places that I'd like to go. One, so we do have a lot of medications that can help. We have a lot of surgeries that can help. But again, you said, on the other hand, that this is a lifelong process.
Yes.
So can we say that these medications and surgeries are just a tool to get you to the right habits, but if you don't abide to the right habits, you haven't done anything? Do you agree with this saying?
So I can just reframe the
Yeah.
question. You have done something, and you
Yes.
have prevented some. You have prolonged your life if you lose the weight using the medications. You have
Okay.
you have treated some metabolic issue that you had or will have. So you have done something. But if you don't do it with all the other aspects of the equation,
Yeah.
then yes, you might be doing more damage or some damage. So you have done yourself some good, but again, it's
Let's
about
keep it. Let's maintain it.
yes, and that's where education, that's where the healthcare provider's role is just, let's say, dramatizing the complications, because no one can feel what it looks like when I have let's say joint pain in 15 years. You can't picture it if you don't have it.
That's true.
But a good healthcare provider will make you picture it, will make you feel it.
Exaggerate the situation now.
You have to
yeah.
you have to make it as real as possible, that this is why I'm treating you.
Yes.
I don't care about how you look like. You're beautiful regardless. You're always beautiful. You look in the mirror. This is something that you need to probably work on, whether you lose the weight or not.
Right.
If you don't like what you're seeing in the mirror now, you probably won't like it if you lose the weight. So it's a different aspect of my treatment. Psychology is very, very important in the whole situation. But
yes,
my goal as a healthcare provider, as an obesity specialist,
right,
is to make you feel good in your own skin,
right,
and to improve that confidence, but also to focus on the prevention and how you feel, because I'm fixing something that you cannot see,
right,
not just what you can see in the mirror.
Amazing. That takes me to my second point that I wanted to discuss, which you mentioned earlier and now just mentioned, is the psychological part of it, right? You mentioned addiction, you mentioned you're not looking good, you don't feel good. So how does emotional well-being really influence the eating habits and the health outcomes, right? I know a lot of people where they've lost 50, 55 kilos and they still look at the mirror and say, I look fat.
Yes.
I don't like it. Or when they're happy, they eat. Or when they're sad, mad, they eat. How much does this emotion aspect really affect us, doctor?
A lot. There's a massive psychological aspect to the whole management and the whole situation here. It breaks my heart when a kid who's 16 comes to me with a BMI of 35 or 40, wanting to be skinny only because they've been bullied for the last 10 years of their lives, let's say. I see families coming with obese children, and even those families are the main source of bullying. And they're like, I've heard something from a family the other day, and it broke my heart, that we actually bully them, like intentionally, because we want them to change. We want to give them that incentive.
Oh, wow.
Imagine the amount of damage that you're doing to that child's brain going into a diet at the age of 14 or 16. Let alone the damage that you're doing metabolically, physically, which is something that we can fix. I'm not worried about the damage, the metabolic damage, to be honest. But the psychological damage and the body image disorder that's going to stuck for the rest of her life or his life, that's a real problem.
Yeah.
And then the other aspect that you've just mentioned, which has a term, which is emotional eating. It's a real thing. And emotional eating is not something that can be taken lightly, because emotional eating has a very deep roots that is difficult to treat. The medication comes and acts on the reward systems, on the reward centers in the brain.
Right.
And that can be partly a first step in the solution of emotional eating, but it doesn't treat it fully. Because again, yes, we can treat the emotional eating by reducing the noise or by removing that pleasure that comes from food.
Yeah.
But again, that's not my goal. God created us to enjoy food.
Yes.
I don't want to take that away from you.
Oh,
but I want to teach
someone
you.
is understanding me.
Because we all love food, right?
I always tell my family, I don't eat to live, I live to eat.
You live to eat.
But they don't like it.
Yeah. that's partially the thing that we work on to reach a point where sometimes you can do that. Sometimes you can enjoy food. Sometimes you can just not think about anything and
balance.
eat.
Yeah.
But when you do the opposite, most of the times when you actually eat to live and eat to survive, that automatically will fix that cycle in your brain.
Amazing.
And it's not, unfortunately, it's not an overnight thing. It's something that takes months.
Yes.
And years and a lot of failures.
Right.
People will fail. And we need to teach patients and educate them that when you fail, first of all, you're a human being. You're a real human being, because unreal human beings don't fail. And I don't know where those people.
I don't know.
We don't. I don't know anyone. Any people.
No one is perfect. We always say.
No one's
we're
perfect.
all humans. We have a human error, and that's totally okay. That's how we were.
Exactly.
Right.
But we say it, but we don't believe it.
That's true.
We're very hard on ourselves when we fail.
Yes.
We're very hard on ourselves when we drop the ball.
Yeah.
And that's when people stop showing up
Yes.
to my clinic.
Yes.
But from the first appointment, I tell them clearly,
Right.
I want to see you when you're failing more than when you're succeeding.
Right.
You're not here to impress me, and I'm not here to shame you. When you're succeeding or when you're not showing up, I would assume that
Right.
you're succeeding and you're happy, and I'm happy for you. I don't want to see you. But when you're
Amazing.
failing, that's when you want to come and show me. I've lost 10 kilograms and I've gained 4.
Yeah.
How are we going to lose them again? Because if you don't see me because you're ashamed and you don't want to step on the scale and show me that you gained some of the weight, you're going to come back with 20 kilograms later.
Yes.
Desperate, or you're not going to you're just going to drop the ball.
Amazing.
So I want to see you when you're failing more than when you're succeeding. When you start with me in a very bad situation, I enjoy it more than when you start with me in a situation when you're just,
It's just about them accepting that.
you have to accept
Yeah,
yourself.
yeah.
You have to accept that it's not you. Stop blaming yourself. Just lift that weight off your shoulder
Amazing.
and start the journey.
That is lovely, and if we keep on asking, we'll keep on talking, but we have time limit.
Yes, I know.
Before I go towards the end of the show, if someone feels stuck despite trying everything, where should they begin or where should they go?
They should, first of all, sit down with themselves and just make the decision that they
Right.
want to change. That's
Right.
the first thing. And then they need to search where to go. They need to seek advice, to seek support. You cannot do something without support.
Right.
Even if you have all the knowledge,
Right.
you can never have it all.
Yeah.
You will have something that's not working because it hasn't worked in the past. So why would you expect that it works now? So you need to search for someone who has the training, the knowledge, the time to give you.
Yeah.
Not everyone has the time
Yeah.
or the sincerity
Yeah.
to give you the right advice. So seek help. Start with support before trying yourself. Because a lot of patients come to me again that they tell me that I want to try on my own and then come back and maybe try the medication. But I know that they qualify for the medication from day one.
Okay.
Some of them, they actually insist and they go try on their own and they come back 3 months later. They say, okay, it didn't work. And then in my head, of course, I say, I know. But I wouldn't say it to them. But I tried. And some patients, they actually get convinced that it's not going to work.
Yes.
Let's start right. I will give you the support to use this as a tool to kickstart your journey, and I'll teach you how to do it the right way this time. And then down the track, if you don't want that tool, you can stop it.
Amazing.
If we feel that it's not the right thing for you. And then again, those medications are weekly most of the time.
Right.
And if you don't like any of them, we can switch between them. You can stop it.
Yeah.
We start at the lowest dose anyways, so it produces less side effects if
Yes.
there's any. I can probably say that I can say 100%, but I don't want to be that extreme.
Yeah.
But probably 99% of my patients who started on those medications, it's been life-changing for them.
Amazing. Are we just talking about the Mounjaro, Ozempic,
Correct.
or do we have any other on
So
board
those-
that can help?
It's the family of those medications,
Yeah.
which is called GLP-1
Yes.
medications, which is the hormone. That's
Yeah.
the name of the hormone. And that includes, at the moment, the ones that we have at the moment are Mounjaro, Wegovy, and Ozempic.
Yeah.
We had Saxenda in the past.
Yes.
At the moment, also, we are working on bringing a lot more to the market.
Yes.
So there's oral
Yeah. There's
medications.
metformin, I think, as well.
GLP-1s,
Yeah.
so it's
Oh,
coming.
sorry, yeah.
So in the
Yeah.
near future,
Good.
it's being approved. It's released in other countries, but not in Australia yet.
Right.
So it's an oral daily GLP-1 medication.
Wow.
Metformin is not a weight loss medication, but it's something very important that we consider if you have insulin resistance.
Insulin resistance. Amazing.
But yeah, those are the medications, and the costs vary and the effectiveness varies. So if anyone wants any information about these medications, they can book a consultation.
Amazing. That was my next question, Doctor. Where can people find you? Looks like you've got a lot of knowledge on your hands. Tell us.
I'm everywhere.
Amazing.
They can follow me on Instagram, and they
Yes.
can learn from all the videos that I post. I have a lot of educational content that they
Lovely.
can find on Instagram. They can find me in My Health Ed Square. That's where I practice.
Right.
That's where I do obesity management mainly.
Yes.
I work there 2 days a week. And my online program, which is the Beyond program,
Yeah.
is online. It's an online platform. The website is called Weight Loss and Beyond, as one word,
Yeah.
.com.au. So weight loss and beyond.com.au. they can go and find the 3 options that I have, which is the group education.
Right.
And we have the one-on-one consultations, which are online as well.
Right.
And there's also appointments to come and see me face-to-face in my practice.
Amazing. We did hear about a webinar coming up soon in April. What do you want to tell us about that?
So the webinar is happening in March.
Yes.
But the program is starting in April.
Okay.
The first cohort of the Beyond program is being taken on the 20th of April.
Amazing.
And patients can sign up directly by going to the website, choosing the group education,
Yeah.
and then subscribing to the program. And just good
Amazing.
news, I have great discounts for the first cohort. If anyone watches, if anyone joins before the 20th of April, there's a massive discount.
That is amazing, Doctor. I still have a lot on my papers.
I have a lot to talk about too.
I'll tell you, I've got these papers, but looking at the time, I don't want to, just extremely extend people's focus. But I really wanted to thank you for your help, for your advice, for the knowledge you gave us to reframe weight loss as a journey of health and not a punishment. And I say it from the bottom of my heart.
Yes.
So thank you so much again, Dr.
My
Mais.
pleasure. Thank you so much, Christine. It's been a pleasure. And if anyone needs to ask any questions, feel free to DM me on Instagram. Feel free to just reach out. I'm more than happy to help.
That is amazing. Thank you so much, Doctor. And before we go, I always would love to tell our listeners, if you've been struggling despite your best efforts, remember that your body is not working against you. It may simply need the right understanding and support. This was Christine from Scientifically Speaking on Oz Arab Media. Until next time.